Omeprazole. Its efficiency. 2-option isomers. Enantiomers. The option S isomers has been developed as a new drug. Omeprazole, which mainly used as active enantiomer. Metabolism of it. is completely metabolized in the liver. The usages of omeprazole. 1. Acid inhibitory agent. 2. Treatment of gastric acid hyper secretion disorders. Propranolol. R. Is enantiomer active. Levosedative. It's used to treat heart problems, help with anxiety and prevent migraines. S. Is enantiomer inactive. Dextro. Propranolol is extensively metabolized with most metabolites, appearing in the urine. It is metabolized through 3 primary routes. Aromatic hydrosylation, mainly 4-hydrosylation, and D-alkylation, followed by further side chain oxidation and direct glucuronidation. Clopidogrel contains 4 isomers, but S enantiomer is the active.
What are the uses of clopidogrel?
Clopidogrel is a potent antithrombotic drug. Clopidogrel is a prodrug that is metabolized by cytochrome P450 in the liver to an active metabolite that specifically and irreversibly blocks the platelet ADP P2Y12 receptor. Rabeprazole is mixture of 2 isomers, R isomer and S isomer, that preventing acid-related gastric lesions. R is more effective than S. Extensively metabolized in the liver via the cytochrome P450 enzyme system. Its metabolites are excreted primarily in the urine. Citalopram is composed of 2 enantiomers. Citalopram and escitalopram are extensively metabolized by the liver.
What are the uses of citalopram? It is used to treat depression.
Ibuprofen is sold as a racemic mixture of 2 enantiomers. R ibuprofen inactive. Levo. S ibuprofen active. Dextro. In the body, about 40 to 60% of R ibuprofen is metabolically converted into S ibuprofen in the intestine tract after consumption.
What are the uses of ibuprofen? It has been used as anti-inflammatory and analgesic agents.
Ketoprofen. Ketoprofen has 2 isomers, S enantiomer inhibitor and R enantiomer is active. Metabolism are rapidly and extensively in the liver. Drug can be used for anti-inflammatory drug that is used to treat pain, inflammation, swelling, stiffness and joint pain. Is that ketoprofen? Yes, ketoprofen. Zopiclone has 2 isomers. They are S enantiomer. Metabolism of zopiclone is partly in liver, 50% in lung, and 7% in kidney. Zopiclone used for insomnia. Metopro. Metoprolol. R metoprolol is inactive. S metoprolol is active. The metabolism of metoprolol is mainly represented by reaction of hydrosylation and O-demethylation, mainly excreted via the kidney. Metoprolol, used to treat high blood pressure. Etodolac, S active, and it is dextro. R is inactive, and it is levo. The metabolism of etodolac is predominantly metabolized by the liver. Etodolac is non-steroidal anti-inflammatory drug. It is used to treat mild to moderate pain and help relieve symptoms of arthritis. Nataglinide has 2 enantiomers. R is more beneficial. It is rapidly absorbed from the gastrointestinal tract and undergoes extensive biotransformation in liver to at least 9 metabolites. Nataglinide is used for treatment of type 2 diabetes mellitus, which stimulates insulin secretion from beta cells in the pancreas. Thalidomide have 2 isomers. R is active. Levo, sedative. S is inactive. Dextro. The metabolism mainly metabolized by the liver, but is spontaneously hydrolyzed into numerous renally products.
It is used for the treatment of skin disease and cancer. Ethambutolus. S. Enantiomer is active. Dextro. Tuberculosis. R. Enantiomer is active. Levo. Blindness.
Metabolism of ethambutolus mainly oxidized by aldehyde dehydrogenase 2 aldehyde metabolite.
It used for treatment of tuberculosis. Styrosine is racemate mixture of 2 enantiomers. Levo is R enantiomer. Dextro is S enantiomer.
Its metabolism is not significantly metabolized in the liver. Only 8 to 10% is metabolized by cytochrome P450.
It is used to relieve allergic symptoms such as watery eyes, runny nose, itching eye or nose, sneezing, hives, and itching.
Ketamine. Its metabolism is quickly metabolized by the liver into less active metabolites. About 90% of ketamine is excreted in the urine in the form of metabolites.
We can use ketamine as an anesthetic.
Pantoprazole. Its efficiency. S-isomer optically active.
Pantoprazole is extensively metabolized in the liver through cytochrome P450.
What are the uses of pantoprazole?
1. Proton pump inhibitors. 2. Ulcers of stomach. 3. Esophagitis.
Atenolol. S-atenolol is highly active enantiomer than R. Atenolol is predominantly eliminated via the kidney. Only about 5% of it is metabolized by the liver after oral administrations. Atenolol is incompletely absorbed from intestine, so about 50% of beta blockers are finally bioavailable. It is used to treat high blood pressure. Amlodipine, also known as S. Amlodipine. It has 2 stereoisomers. S is active. Levo. Amlodipine is largely metabolized in the liver.
It is used to treat high blood pressure and some types of angina.